what you're doing up there in Massachusetts. Governor Herbert, welcome to you.
Thank you.
Gentlemen, very quickly, I note, Governor Patrick, you've had firsthand experience in implementing a state-level reform law, and that you support the federal law and find that it will work well with your statutes up there. Is that right? Governor Barbour, I gather you, my old friend, have a different view. You've supported overturning the law. Am I correct?
That's correct, Mr. Chairman.
And Governor Herbert, I gather you've also supported overturning the Affordable Care Act. Is that right?
We've joined in the lawsuit in Florida.
Now, gentlemen, I want to see where we are. We have embarked upon a great challenge and upon a great testing of our national will and capability here. And so let's go through some of these things. In the case of Mississippi, Governor Barbour, you are aware that the health care insurers can no longer discriminate against 180,000 children in Mississippi with pre-existing health conditions. And you're also aware that as a result of the Affordable Care Act, about 53,000 businesses in your state, as in other states, will be eligible for $350 million in new health care tax credits. And Governor, you're also aware that 1.5 million residents of your fine state are benefiting from consumer protections in the Affordable Care Act, such as prohibit annual and lifetime coverage bans and limits, ban on rescissions, and provide safeguards against unreasonable care increases. Now, and you, Governor Herbert, thanks to the Affordable Care Act, find that 20,000 seniors in Utah have already received $250 rebates from high Medicare drug prices as a matter of relief. And again, in Utah, the Affordable Care Act now permits 270,000 Medicare recipients in Utah to receive free preventive care. And in Utah, again, I note that the uncompensated care costs borne by Utah hospitals and healthcare providers will be protected against over $1 billion in the next decade. And also that in Utah, the Affordable Care Act, there are over 200,000 otherwise uninsured state residents that will be able to afford and to obtain affordable health and effective health coverage. Now, gentlemen, we have all this before us, and I'm trying to understand. If you could assist me, you can start with you, Governor Herbert. Remembering I don't have much time left. What are we going to do to replace these benefits if we repeal them? How are we going to make whole the categories of persons that I have just mentioned who will be significantly benefited?
Well, I think, as Governor Barbour has mentioned, that we really do care about our people in our states, and we'll find solutions.
That's not an issue, Governor. I don't want to get into that debate.
Okay, it seems
it's not
like
a proper debate.
It seems like the approach from Washington is do it our way, or it won't get done. Again, Utah has good health care, has had good health care. I guess, come from the position that as we look to those who need the benefits and we define what those benefits are, there's nobody can define them better than the governors and the people in the states. So the eligibility, the benefits that ought to be received, we can help define that better than anybody, I think, else, certainly better than people
Governor,
in Washington.
I apologize. I got 58 seconds to share between your two colleagues.
Chairman Dingell, thank you. A couple of points. Most of our small businesses won't qualify for those subsidies. However, the standard benefits package that we expect to be put on us will cause many of our small businesses that today struggle to provide health insurance to their employees will drop that health insurance because the standard benefits package is going to drive the cost so high. As far as the pre-existing condition, we recognize this issue in Mississippi long before Haley was governor. And for about 15 years, we've had a pool, a risk pool for people with pre-existing conditions. It has about 3,600 people in it right now, and that's about average. As you can imagine, people move into it, and then when their pre-existing exclusion expires, they move out. The federal risk pool has 58 people. Even though the cost is less, the premium is lower. And so this is just an example of something that, I don't know, I'm told 35 states have a risk pool like us, or similar risk pool. There are things that we do can do, and we're doing them, and we think we should be allowed to make those decisions instead of having community rating, high mandatory benefits package increase the costs of health insurance in our state.
Governor,
That's our concern.
Governor, I just want to hear a word from Governor Patrick. Governor?
Well, we see a tremendous amount of flexibility in the Affordable Care Act today. We see some further benefits in terms of federal tax credits for the next tier of people we're trying to reach. We see some tools to help us get at the dual eligibles, which is a number have mentioned, and I know my colleagues agree, is a particularly expensive part of the healthcare system. And we see some flexibility to try new things in terms of payment delivery systems and payment reform, which is where the real pickup is, not just in Medicaid, but for the healthcare cost system generally. So for us, this is a good bill and one worth fighting for, and we intend to fight for it.
Mr. Chairman, I thank you for your courtesy.
Gentleman from Illinois, Mr. Shimkus.